Mine, what happened was the Naval Hospital, we had we were going to do a pilot study for the Naval Hospital. And it was a randomized placebo-controlled study. Can you guys see? Am I too much in front of it? And there were four capstones that came out of it. The first one was to develop the questionnaires to see the different kinds, the different patterns. So we developed the points according to the patterns they were going to be presented. And that was done by Patty, and then Pierre did the point combination, because we had different patterns, so we had different point combinations. And so that was a hard one, because we had all these different doctors deciding, okay, this is better for lung qi deficiency, this is better for, oh no, I use this point. So to get all that together was a little bit difficult. Mine was developing the needle, the Sham needle, to be used in the project. And the last one was analyzing the data that came out of it. So that's how this whole thing started. And I ended up, honestly, with the needle because nobody else wanted to do it. And Dr. Miller was looking around, and I said, okay, I'll do it. But anyway, it was fun. So the pilot study there were 3 arms with 20 subjects on each arm. There was going to be the viral acupuncture, and that's where my thing starts, the whole thing. Because what happened was, there were 9 treatments for each one, for the Sham and the viral. And those 2 treatments, the first week 2 treatments, and after that 7 more, once a week. And that's how we started with all these needles that were necessary. Because this amount of the needles that we needed, because we have different patterns for the viral acupuncture. So because of that, there were between 11 and 15 needles for each treatment. We thought about maybe doing it in a way that we could reuse the needles. But I realized that some of the acupuncturists especially were very adamant at the time that we had a group discussion about the same amount of people we have here. And they were saying, no, you have to think about clean needle technique. You don't redo it. You don't redo it. So we had to, every time we needle, even if it's Sham, don't go and use it again. Don't reuse that needle. So that's how we end up with this amount of needles. So for each treatment, it would be between 99 and 135, and then the total for the 20, that's that amount. The Sham was easier because the Sham is always the same amount of points. You always had 10 points. And that's how we ended up with this huge amount of needles, and that's when really made a difference to create our own Sham needle that was cheap. That's the bottom line. And my purpose of study was to create an affordable needle that could be easily replicated, was easy to construct. And we had to make sure the subjects, they were going to feel, in the Sham group, they felt they were needled. That's another big deal, was a huge deal. And the third thing was the sensation, if the ones who were Sham. Am I speaking? Because my accent sometimes doesn't help. So tell me if you guys need it. So, and then the sensation, try to make the sensation similar between the 2 groups. So, if you guys have any questions, if this is not understood, let me know, okay? From there, they were available on the market. They are the main ones. Streitberger, that's the first guy that came around. And this guy copied pretty much, made it better. So, and I don't know if you can see, this is the way it is. It still is that way. The Streitberger is German, and Asia Med is mostly German needles. They even have some that are similar to the Sarin needles, but they're not as good. They get stuck when you try to. Cheaper, okay, but it inserts well, but it's difficult to get out of the insertion tube. So they come in 200 needles. It's a package. You cannot buy individually. When you buy, that's what you buy. The Park Sham is a different story. It's, I think the main one now is in England. The main distributor is DBC. It's from DBC. Park, Dr. Park, he's Korean, so he went straight to the source and got pretty much a great product from DBC. and that's what he uses. By the way, Dr. Park now, I think it's in Chapel Hill. I was Googling him for something that I need a picture, and then I put him, now he's in, I think it's Chapel Hill. He's working there as an acupuncturist in the hospital. But anyway, so he was talking about acupuncture and all that. So these are the two main needles. Now that where the good part is, this is my needle. Okay, look at the difference but the idea is the same. We have, let me go back for a second. The Park Sham and the Stratberger, when you press down, it collapses. It goes back into the handle, which is marvelous. You try to do that, the needles that are available, it's very hard for you to take the needle out of the handle and try to put it back. You can do on a few, but if you try to do 1,000, becomes very difficult. And what I found is that doesn't work very well. Some of them work well, some get stuck, and that's why I decided to go ahead and change everything. So what we did, we cut the needle. The needle is going to be, first of all, the point, we cut the point. So it's completely, and you cut it, and then you have to go one by one, get those metal, how do you call it? File. And then do one by one, and then you have to disinfect them after. And Cavicide, that's what I used. So we have a tube, and I have some of them here, just in case you guys want to see. Am I getting ahead of myself? Most likely. But this is I still have one left of the very high-tech. This is one we gave to each person, and this one happens to be for the DAOM acupuncture. So they had a little card, and according to the pattern, we would mark, and that's what the person who was going to be doing the needling would get. And at the end of the day, whatever, put back whatever was necessary. But these are the way they work. So if you guys want to see, that's what the needles look like. And these are the Sham needles. I don't know if you want to pass it around. If anybody wants to take a look at what they look like.
This is the base.
That's the base. What we have, because these needles are not, and this happens with the Park Sham too.
And these are the ones that are cut off.
Yes. Do you know what these are?
How did you get them back into the package?
Huh.
We should probably not get into this.
Very nicely. No, do you know these are? No, these are just the tubes. I'm sorry, these are just the tubes. I thought that's why they were there intact. But anyway.
Okay.
So what happened? I'm sorry. What did you ask?
Did the Sham needle and the regular needle all have the same base?
They do have to have, because what happens is, in my case, what I did, I just did once. But in case you're going to, if in the future they're going to use real acupuncture and the Sham, you have to, for the subjects not to know, we'd have to go and look exactly alike. So we had to do the same thing. We had to put the base, and there's a base here with a foam, and then of course this is a double tape on the bottom, the base. Over here is another tube. We have to have a second tube to insert the insertion tube, because that's what is going to keep things in place. Is that too confusing? And that's what it looks like when it's on the hand. So we have the base of the needle, we have the stabilizer, and the stabilizer has to be there because there's nothing holding the needle. There's no anchor there. So if you move, that flies away. So we had to keep it. Now that's where the prices and what is hard, because at the time I could not find some of the DAOM acupuncture. The Park Sham was only in England that the distributor was. So that's why, and I put on the bottom there how much was the value of the British pound at the time. So this is for 200 needles, and it has to be 200 because Stratberger had 200 needles. So I tried to make it all equal. And that's how much it would cost for the Stratberger, how much would be for the Park Sham, and how much would be for our needle. And of course, the $40 is just to buy some supplies to assemble them, and that is a one-time cost. Any questions?
That's amazing. What about the hours assembling it?
Oh, that takes a long time. It's a labor of love. But the thing is that if you don't have the money to buy these things, it's okay. Most of the time, you don't have the money because you have enough time. You're not working that much. So anyway, I don't know. But you may be able to find somebody to help you. It's not difficult to assemble. It really isn't. Now, and this will be the total cost of the whole project, the whole study. So that's why things made a difference. And there's a difference here in price because all depending how many needles you're going to use for the verum. This is the least amount of them and the most. And what really doesn't cost much when you have the serum needles add to it is nothing. Now, the literature, I just put a few things here because it was horrendous. There was so much stuff, and that's where the problem is. One of my favorite books was the Benedetti's book about the placebo. That was entertaining, and it's the placebo effect, and it is one of them. To me, another very important is that we still don't get together in terms of understanding what really is acupuncture. Because what they consider sham, still to this day, there are some studies doing sham where they still needle people. And they
Terminology.
and they still call it non-acupuncture points, no acupoints. That to me is unbelievable that they still believe that you insert a needle, doesn't matter where it is, it's not going to have an effect. Anybody who works with people know that do acupuncture know that there is an effect, doesn't matter what it is. I mean, that's my opinion. I'm not a doctor yet, so I cannot have an opinion. But anyway, so there's two of the most important ones. There are many different things that people go in all different directions. Even there have been studies showing that there is even a sham needle, a park sham in the case was. If you have enough needles in the body just resting on the skin, there is a difference on the brain waves. The CAT scan can pick up differences. So things change. So that's why the whole sham thing, to me, it's a little bit difficult to get. Another thing that you see a lot is that in a lot of studies, you're going to have people who say, okay, this was sham. The verum needle, we had good results. We had a lot of difference between the verum and the placebo or whatever they use as a placebo, but the sham group did almost as well. And the main reason, if you go and look into the studies, a lot of times it has to do with the things what they consider the non-acupoint, all the old stuff that we know that just by looking at it, that's not really there, it's not really true. So anyway, I hope you guys understand what I'm saying. Now, the way we did, and that's what the whole problem was it took a long time to get this needle going. And like I said, we had a committee of acupuncturists, not a committee, but a bunch of them would come up and talk, and everybody had ideas. Some of them ended up screaming at the end of the whole thing. So at the end, when I finally got it, I thought I got it, and then someone said, oh, that needle is too thin, because he was going like this, and of course went through the skin. So I had to start all over again. By then we have about 3 weeks to have the whole process going. So I had to go back and find specific, ended up the 32 gauge needle was the best one to do it, because to cut, and you still put on the skin. You have the sensation of being needled, but it doesn't go through. If you get too thick a needle, you just feel something funny, but it doesn't have the sensation. So we decided for 2 groups, the verum, acupuncture, and the sham. There were 40 subjects, and the inclusion was 18 years old and older, and everybody would go in unless you had chronic or acute pain, you're pregnant, needle-phobic people, bleeding disorders, rashes in the area of LI4, because that's where we used LI4 only because it was an easy place to do it. And people taking any kind of medication for pain or drugs, and someone who have a hypersensitivity or hypo on the area, on again, LI4. Okay, the way we did, we asked people who came in, ended up being only 2 people at PCOM clinic. The rest was at my clinic that I was just opening. So people didn't know who I was anyways, but people who came and got, this is my daughter Leah, so we worked together. So people who came to be treated by her for the first time. And one thing that I didn't put in here is that we decided also to use a subject who have been needled before, which I know sounds crazy. The majority of the studies, they use people that never had acupuncture naive people. The problem is, as you're doing it, and Doug was the one who said, oh, you cannot use these people, but he's one of the people in our group. So, because if you never had acupuncture, you really cannot judge if you're needled or not. Because some people come in with the idea that the acupuncture, the way it's going to be like a shot, like an injection, and it really isn't. So sometimes I would use a real acupuncture. This is before we even start doing anything, before this. And they say, oh, I didn't feel anything. But it was the real acupuncture that we used. So one of the guys said, let's just get people who had acupuncture before. So this is going to be a better way of measuring if this is going to work or not. So again, it was all, they already experienced being needled. And there were 2 different groups. And then when they came in, we just said, we are going to be using a needle stabilizer, and we'll show that to them if they would like to participate in the study. Then if they said yes, they would go and fill out a form saying that they are participating, all the stuff that we had to get. I don't even remember the names of them. But anyway, then we are going to be using, then you needle. We are going to put alcohol, just like you do with a regular, in both cases. Then you put the stabilizer, you needle, wait a minute, take the needle out, and put a Band-Aid over on both cases. So, and that was pretty much it. And then they would go to their own, no, I'm sorry, before they are going to be, no, let me go back. I'm confused here. So they go in, okay? They have all the criteria. They can go and be needled. We asked them if they want to do it. Yes. There was an A and B group inside an envelope. It was a black envelope. Even I went that far. Put a black envelope with the letter A or letter B, and all inside a bigger envelope, a manila envelope. So if they said, okay, I'm going to be needled, the receptionist in the case of the clinic would go into that and pick up a number, pick up one of the envelopes and see if it was Virum for A or B for Sham. And then they would go and be needled. I would know because I had, unfortunately I could not be blinded, but then they would go to be needled. They spend the minute. After the minute, they would go and fill out this form with all the different sensations that you could have. And then they would go in procedure to their acupuncture. In that scale sensation, we have if the age, if male, female, if they had acupuncture before, and how many times, and then if they felt that there was some hindrance by having the stabilizer on the hand, and if they felt they were needled or not. And then they would go and do what they felt in terms of the sensation. Some of the people were crazy. I mean, there was some stuff that I couldn't believe. But anyway, so, and that's it. And that that scale survey was then taken away, put in a different place, all in a manila envelope. And this, at the end of the 40, we and put the sensations were, let me go back. Here what they did, not at all would be a 0, mild 1, moderate 2, and severe 3. So if they just marked, as you go back, and then that's how we went and collect all the data for each one, because these numbers over here are the ones we're going to be using later for the statistics. Okay, now, the limitation of the study, there are many, but it's a small scale. I was, as an investigator, I was the person who designed and the person who assembled the needle, the person who needled them. So there were just a few instances where Leah did it, because I think it was here, because none of us know them, and she did it here, but the majority of the time I was the one needling them, unfortunately. I wish I wasn't. And I wish we had more time to cross over, to have everybody who had sham to go and have, the 20 people to go and have the real acupuncture, and vice versa. But our concern at the time is that these people may not ever come back, and then you have to start all over again. You have to create another one. So we decided to go ahead and forget about it. Just do it this way. And what I said before, because the needle didn't go back into the shaft, that was, you had to really know what you're doing, because you could not go heavy, you cannot go too light. You have to know what you're doing in terms of needling, which if you ever get a sham, even the good ones, the ones on the market, you have to know what you're doing, because it's sometimes it doesn't do very well, it pops up, but anyway, so these are, so you had, because you could, anybody, you can use anything to, if you had a toothpick and you hit hard enough, you're going to go through the skin. So that was, for me, it was very important, the training before you do it. And the people that we had, they are mostly females, which is part of acupuncture. That's most of the clients that we have. And the age ended up being not that different. It was 38 to 35 was the mean. And the number of treatments was between 1 and 8. And what we found out is that of the 18 subjects, 18 on the VIRM acupuncture, they felt they were needled, and that is 90%. And on the sham side were 16 of them, 16 out of 20, and that's 80%. And that's, in the statistics that with this Fisher exact test showed that the difference between the two was not that significant to make a difference. It was pretty similar. And all of them, because we asked on the survey, every single one felt that they were needled, and that also the stabilizer didn't bother them. They still felt needled even through the stabilizer. And this is more statistics. So the score from there in sham, that's the total score, all the numbers, that huge thing that you saw before, that's what you get, that the difference between the two groups was just 0.19, which is not that different. That's not that significant. And Tom said so. The other one, Tom said, okay, it's great, this is good. Now the other one, the intensity, and that's where things are different, because in the intensity of the needling, the people who had VIRM acupuncture, in general, they told us that they marked more intense treatment. And so, but still the difference is not that much between the two groups. Now this is the same thing in a graphic. So the sensation, some of on the sham group, the spreading, the aching, the hurt, and the burning, which a lot of it has to do with more feeling the needle in the hand. they report not feeling it. And none of the subjects report shocking sensation, which for me is nice, because when you get a shocking sensation, you hit a nerve. That's not good anyway. So, but none of them got that. That's me. That's what I think is not right in having those sensations, shocking being one of them, because this is not acupuncture. That's not the chi in my book. But anyway, I'm not a doctor yet. So now I have my problems. Now, the idea was to create that's how the whole thing started, to create an affordable sham needle. Is not to compete with anybody. It was just for a very specific purpose. And also being able, maybe some people being able, if you have a small clinic, but I mean not small, not that way that I'm talking, but you have your practice. And there are certain things that you do and you feel like, hey, maybe I could do a case study on this or something like that. That's something you can assemble and do your own study. You don't have to go and buy a bunch of expensive things to do it. And that's just one of the ideas. And was never meant to be an alternative. And the thing is, we want to make sure, verify if the subject in the sham needle group felt they were needled, and 80% of them did. And verifying there's a difference in sensation between the sham acupuncture and the verum using this needle. And the difference was not that much, that great. So we felt it was okay. And this needle is very easy to, the way we ended up doing, and on the capstone, if you guys want to look, because I didn't put all the pictures. I didn't know you guys were coming. So I didn't go into the process of putting the pictures. So
we can wait.
You can wait a bit. I can send it to you. I really can. What I would say, okay, it's easy to replicate. Really is. It's very simple, and I have all the measurements. I even put you put 7 millimeters here and 5 millimeters there, and you get there. And it's not hard. And then we did have the impression that the people got the impression they were needled without going through piercing the skin. This is a little, I feel like for what I did, this is okay. The performance is comparable, but it's not the same kind of thing. It's not the same, it's not pretty, but for what we did, it worked. And I do believe that it's very cost effective if someone really wants to go ahead and do a study on their own. This is something they can create their own needle. And from here can do something even better. Now, the recommendations that any sham needle, even the Park Sham and the Stratberger, you have to, as an acupuncturist, the first thing, especially when you're doing using an insertion tube, what you do, you go there fast, because that's the idea of the tube, is to go through the skin fast and not hurt. And it's a different feeling when you're doing, even the Park Sham, when you're doing the tapping, is a different tapping, even though it goes back. But even if it goes back, if you tap hard, you're going to feel the insertion tube, like, oh, what the heck is this? You don't feel the needle, but you feel that. So you have to be trained on that. And especially with this needle, because it doesn't retract, and then you have to have the right amount of pressure. It's not hard. You do about 10 times on your hand, you get the hang of it. It really. And the stabilizer, that's where I find with all of them, not in our case, and we didn't do even for the Naval Hospital, but in some cases we're talking about some of the studies, they even talk about manipulation of the needle. If you're going to go more to one side or the other, you're going to have the depth of it. And when you have, especially the fat one that I have or the others, it's difficult for you to go and manipulate that needle, to really do a real good job. So in that case, it would be more difficult for some people. One thing that we had some problems They have never worked because I was watching them all the time. But when you were at the Naval Hospital, and then the other people in needle said the same thing, we have to make sure when you have special people with big bellies, because they had some certain points on the side, or the hands and feet, is difficult because people fall asleep and they move. And these needles are not going to stay in place. So when you are deciding for a protocol with a sham protocol, try not to go on the hands. Feet are easier, but the hands are the worst. Because people do move their hands. They scratch themselves, they fall asleep. And when you come back into the room, the needles are on the floor. So these are some of the recommendations for future acupuncture protocols. Now this one, I don't even know if you guys want me to go through this. This is my ranting and raving at the end of my capstone. But see, there's so many things going on. So the physiological response, and sometimes they are going back to that now we can see because of CAT scans and other stuff that people can do in the brain, you can really see that the perception of being needled just by staying on the skin, there is a change, there is a physiological response from the body, and how much that's going to be a placebo effect. That's when the placebo, the real acupuncture, and everything becomes more difficult. I don't know. Am I making sense here to anybody? No. Yeah. Okay. Okay. So it goes back to that. The sham needle is going to have a physiological response. And the other thing is, if you put a bunch of them, it's going to change the outcome of this study, whatever it is. And so it goes back to my favorite non-acupoint, that when you design a protocol, you should keep in mind that there is chi everywhere. I'm preaching to the choir here. You guys know all this. That's not just for us. But then it's going to be a response. And the non-acupoint is just an area where there isn't that much chi compared to what we consider acupoints. But maybe it doesn't pull, the chi doesn't pull there, but it's going to have a response. That's what the Usher points that we do it all the time. And most of the time they are not on acupoints. The patient's expectation, and sometimes they use it a lot. Again, in research they say it a lot when we do, especially acupuncture, that's what the expectation, because it's the bias of the patient, because they're used to acupuncture. But in my opinion, everybody who goes to, if you sign up and there are a bunch of them on the radio for a headache, for this, to be part of a study, it's like when you buy a lottery ticket. You are not going to go to get the placebo. You're in for the real deal. The same way, when you buy a lottery ticket, you're not saying, okay, I'm going to buy this because I'm going to lose. No, it's the possibility of winning. It's the possibility of getting the real treatment. And that is going to elicit a placebo response on the person. That's my opinion. But so that expectation of the patient is something that is always present, and you have to counter that when you look at the data at the end of the research. And again, the synergy between the person needling and the person receiving, that again is going to create, that synergy is going to change the outcome of the procedure they were doing. And again, the role of the acupuncture is important. And understand the synergy of point combinations, which when you have a committee deciding on points, a lot of times that's what you see a lot. Okay, for this pattern, I think these points are good. Somebody else will get a bunch, and there'll be a third or a fourth. And what normally they do? Stomach 36 in all of them. That's a good point. And they'll get the ones that have the most. But when you put these points together, they're just random. It's not the synergy that you as an acupuncturist, you decide on certain points because you think they work together. So it becomes really, I don't think that's not a good comparison of what acupuncture can do. And I'm not even going to, the biases that exist for acupuncture, but again, I think it's a huge bias that we're trying to create. We still try to create. A lot of the research, protocols are done according to Western medicine, but our medicine is a little bit different. So maybe you should change a little bit more than what we do. Now, I'm not even going to go there. I'm just mentioning animal testing is ridiculous because you get a rabbit and you put laser acupuncture on the pulp of the tooth to see if that stuff works. That animal is going to move. When you feel that much, it's too much stimulation on the point. You don't have to be that strong. When you use animals, what we're doing, they don't respond like us. They're going to say, ouch, it hurts a little bit. They cannot say anything. So the intervention that we do is much, much stronger. So it's not going to go and really make much difference when you're using humans. Do I make any sense? Probably not. But anyway, I don't think every time I see animal testing in acupuncture, I think it's ridiculous. And now the laser acupuncture in research, you see that a lot. And it's done mostly because it's done by doctors. Acupuncturists don't do it much because in most states we cannot even do it. It's illegal for us. But it's there. And that's my story. Any questions? Oh, shut up. Any questions?
I actually have a couple questions about
Yes.
your sensation scale.
Yes.
So the needle, when you were designing the needle and had, you first attempted to test the sham needle on acupuncture naive patients, and they were getting responses more than normal because they were expecting?
No, this was even before. We never got to that point. I mean, we were testing, but they didn't know what to expect.
Okay, so then you switched to anybody who has had acupuncture.
Yes.
I know that many of the participants actually have experienced acupuncture for 10 to 20 years.
Yes, yes.
So you have these two scales, which I don't think you showed everybody, but they're in your...
Yes, they're here.
Okay.
That one,
So,
all the...
when I'm
Let me look
looking
for
at
it.
the data from
Yes.
the sham group to the
I'm listening. There?
yeah, I'm questioning the sharp sensation.
Mm-hmm.
Like several of 9 of the participants indicated they felt a sharp sensation.
Yes.
Were you surprised
Yes.
at some of
Yes.
these
Oh, yes.
numbers? That you
There was, yes, of course I was. And also I was surprised, some of them, sharp, I can even say, hey, maybe that needle hit more than it, not, it feels the sensation. But sometimes even how is it?
And penetrating.
Penetrating.
Six people
Yes.
felt it penetrating. And these are people who've experienced acupuncture.
Yes, yes. On the other hand, also people who had acupuncture before said they never felt anything. There was one guy, I wish I had, he didn't have any acupuncture. Which one was, I don't remember the numbers. But he put, I guess, 3 on everything. But he was a little bit different. So, but did I answer your question? Yes.
So it's surprising.
It was.
So based on the data from the sham group, the team moved forward with the study and
Yes.
you trained the practitioners
Yes.
in the study that were at Navy Medical.
Yes, what I did, I believe 2 rounds. Leah did 1 round, and there were other people too. I don't remember how many. I don't remember how many. This was many years ago, 3 years ago, 4. So,
Yeah.
but there were some of the sensations that when we were analyzing, we looked, oh boy, how did they feel this? And when you feel sharp, the first thing that comes to mind, as for me, was, did I goof? Did I mess it up completely? But I don't remember who was the person. Another acupuncturist, another one in our group said, but that you feel it doesn't mean that it went through. But if it doesn't go through, you felt the sensation of sharp. How much that's going to do to your brain? How much that's going to affect? So all these things are questions that I don't have any answers to.
Can I comment? I know that when I had the Sham done, I actually felt the needle more. Because when the needle goes in quickly, you don't feel the metal. But when it was resting on my skin, I felt the metal more. So maybe that's why the
Could be.
sharp sensation or whatever.
I have a question about the scale itself. Where did you get the criteria in that scale?
That scale is from Vincent. It's from 1998. And what he did is on the capstone, he did the,
This is a validated instrument.
Yes.
Okay, yeah.
it was used by Park Sham, used the same one, I think Stratberger too. And what he did, he got, I think, 20 acupuncturists to come up with all these different sensations that are possible. And then he did that thing. He got the ones that are most common, and he put a scale. And that has been used not only for acupuncture, but for pain sensation in general.
Can I just be clear on something?
Yes.
This wee device is quite fascinating.
Oh, yeah.
It's great, it's very light, it seems to do the job. And it comes right through, so in every instance of needling, sham or real, the needle actually comes through the tube.
Yes.
So the only difference between the sham and the actual acupuncture is the blunted needle.
Yes.
That hits the skin.
Yes,
and
exactly,
If
exactly.
it bounces back or if it just rests there.
Rest there, supposedly. You don't want to bounce back, you just want to rest there.
A little bit like Japanese acupuncture.
It is. And that's why I didn't go in here, but on the study, yes. Japanese acupuncture does that a lot. That's why, what is that? What is a sham? What is a sham needle? If it rests on the skin, it still works.
Right. And most of your points, I mentioned in the summary, I saw it was LI4 that you did.
Yes,
And that's an actual point.
yes.
Did you not think it would increase your chance of having as near sham as you could get by choosing something that wasn't a point rather than something that was a point?
Well, the main reason was LI4 has been used before and was used for Stratberger and Park Sham, the two needles they were trying to compare to, and that's exactly the same point they used. So trying to see how similar we could get to them, that's why we did it.
In the study, the Sham points were used along with the Sham.
Yeah,
Is that what you're
yes.
asking?
No, just to do it. No, for us was just LI4 is an easy one.
Consistency with
Oh yes,
previous studies.
yes. It's just because if you come up with a very different point, it's exactly what there'll be always critics saying. Hey, why didn't you use what they did? Why you went with something so different?
So it was part of
It
your...
was yes. It was just to do as close as we could. That's why we use the same sensation scale. We use the same point.